As local, state, and federal government officials grapple with ways to treat and contain the coronavirus pandemic, some of the best policy responses are coming not from imposing new regulations, but from scrapping old ones. CEI experts are leading in the fight against never-needed regulations.
Well, the single biggest issue we had was testing. Our monitoring systems weren't adequately testing for the virus because the Food and Drug Administration would not allow clinical health laboratories to create their own tests, absent going through a lengthy and expensive pre-approval process. There were a number of mostly university-based laboratories asking the Food and Drug Administration for permission to develop tests. The FDA had approved a single test developed by the U.S. Centers for Disease Control in Atlanta and put all its eggs in that one basket. But it turns out the CDC test kit was faulty. After it came to light that dozens of these laboratories had been denied permission to begin testing, that put pressure on the administration to loosen up those rules. The Food and Drug Administration started granting emergency use authorizations for laboratories, both nonprofit, hospital and university-based laboratories, and then eventually commercial diagnostic manufacturers to develop new tests, get them to the market much more quickly. As a result of this loosening of FDA regulation, we went from testing only 500 total patients in the first 4 weeks of the outbreak to now testing over 500,000 patients every single day. In effect, cutting red tape means more testing. More testing means saving more lives.
Deregulation of the COVID testing process wasn't the only thing that helped patients. With business lockdowns and stay-at-home orders in effect, we needed to find a way to help the millions of Americans with other health conditions.
Fortunately, both the federal government and a number of state governments have waived a lot of their regulations that have previously inhibited the use of telemedicine or telehealth. The immediate benefit of telemedicine is being able to see a doctor at all in an environment where many doctors' offices are closed and where hospitals are only seeing emergency patients. It also means that hospitals are less crowded and the doctors there can focus on treating emergency patients, including patients with COVID-19. Everyone from doctors to the patients to policymakers are realizing that the rules that used to inhibit telemedicine were never really needed in the first place because they didn't protect anyone. And now, with hundreds of thousands, maybe even millions of people having benefited from telehealth services, we're going to see a huge demand for permanent repeal of these rules that were never really needed.